My name is Beth Frederick, and I'm the Deputy Project Director for Advanced Family Planning, which is a project of the Bill and Melinda Gates Institute for Population and Reproductive Health. 9/11 was sort of a wake-up call. I'm now very committed to having an emergency preparedness plan wherever I work. That wasn't the way I thought before 9/11, and I don't think it's the way most people thought. The morning of September 11th was an amazing day. The weather was beautiful, and I was working with the Guttmacher Institute, which is a think tank on sexual and reproductive health and rights. They have their offices in downtown Manhattan, and at that time were located at 120 Wall Street. The team that was there in the office was not prepared at all. And what was really surprising is that first of all, the team was a really cohesive team, and they worked well together under normal circumstances, and under these extraordinary circumstances they worked together even better. You couldn't predict who was actually going to take a leadership role, so some of the mid-level staff people actually were the ones who came up with a plan to have pairs of staff people move out of the building and move home, because many of them had to walk on foot. The Guttmacher Institute, several weeks after 9/11, was one of the recipients of one of those fake anthrax packets. The receptionist opened it up, it sprayed powder in her face, and it was, again, a very surprising thing to look at the team, because the woman who was at the front desk and opened the FedEx package was incredibly calm. Several others had very extreme reactions, and there was a lot of need to sort of manage the team through that process. When you're working on a day-to-day basis in what you think is a fairly secure environment, it's really very important to think about the mental health implications of that kind of emergency. People have very, very strong emotional reactions, and that's not really a workplace issue most of the time. So as a leader, it's really important to learn how to manage those emotions. And I do think in the last decade, mental health has come into emergency preparedness and crisis situations in a much more prominent way than it did before 9/11.